Hi everybody, today's video is about the care and keeping of girl parts and how to tell if your little girl may have a urinary tract infection. I think this is an important topic because one of the most common reasons for visits in my pediatric practice is parents who don't know if their child has a urinary tract infection or not. So I want to explain to you a lot of times what's going on, what could mimic a UTI, which stands for urinary tract infection, and things that you can do to keep those little girl parts healthy so that you don't have to worry about whether or not they have them. So the problem is anatomy, just the way we're made. Little girls have a short urethra, so they are more at risk for a true urinary tract infection. But they also have labia that can hold in moisture and bacteria that can cause irritation and redness. And so what happens is as the urinary stream passes over this red irritated area, it can burn and can be painful. And so when the child complains of burning on urination, of course that sounds like a UTI. And so you may rush to the doctor's office to see if it's a true UTI or not. Now, understand, you should always ask your individual pediatrician specific questions about your child. Understand that we always would prefer to see the child and check a urinalysis if you're not sure. But I just want to give you a few common sense tips to keep things healthy down there so that you don't have to waste your time, money, or co-pay figuring out something that was probably not necessary. So, for just external irritation, there are lots of factors. Often we see this most between the ages of about 3 to 4 up to maybe age 8. That happens to correlate with when little girls are learning to do their own hygiene when they go potty. So one of the most important things, first of all, is to teach them to always wipe from front to back, because the #1 cause of urinary tract infections is a stool germ called E. coli. Well, that particular germ was just made for causing UTIs. It can crawl up that short little urethra, get into the bladder, have a party, multiply, stick to the bladder wall. And so that's why it's so important to stay hydrated and frequently flush and empty the bladder out to wash out those bacteria. But it's also why it's so important to wipe from front to back so that you don't accidentally bring up bacteria from the back to the front side. So for health and maintenance down there, we want careful wiping, so good hygiene. We want to stay as open to air as possible. Those labia can hold in moisture. So anything that's keeping that area moist, wearing a wet bathing suit too long, can make it more irritated and have a rash and burning and irritation. So keep it open to air. For girls that are potty trained overnight, they can sleep at night with no panties. They can just sleep in a big t-shirt or in a gown so it can air out down there. We have a lot of strategies for when the area is actually very red and irritated and sore. And they can include, you can run a warm bath, sprinkle baking soda in there, fold a full bath-sized towel into a square and put it on the bottom of the tub. Let your little girl sit on that towel so that you're gently cleaning. We never want to scrub between the labia. We never want to use soap between the labia. That's a delicate mucous membrane and it doesn't need all that trauma. That will make it worse. And I think a lot of times parents think, oh, it's dirty or it has a smell or it's red, so I must scrub it with soap. And that's the worst thing you can do because it would make it more irritated. So this baking soda bath strategy when they sit on the folded bath towel is a gentle way of cleaning without scrubbing and it doesn't hurt them. And don't use bubble bath in the bath because that irritates that area. And what happens is, I've had parents tell me before, so my daughter can't take bubble baths because they cause a UTI. Well, not exactly. It's not that there are bacteria in the bubble bath. It's that the bubble bath irritates that delicate mucous membrane. It's red, sore, painful. Then when she does urinate, it burns when it touches it. So that tells her to hold it. Well, yes, if your daughter is holding her urine, that can increase her risk of having a true urinary tract infection because like we were talking about, that gives that E. coli, that bacteria, time to multiply more and cause the real deal. So we don't want that either. So that's why we recommend not doing bubble baths. But baking soda is is fine and very helpful and cleaning and not damaging, and it's just soothing to that area. And then when your little girl gets out of the bathtub, you pat, 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 even down there, don't scrub. And then, this sounds crazy, but it works great. You can use a hair dryer on cool and blow dry her whole little fanny area. By the way, there's not a good word for this area. I call it girl parts. I've heard a lot of hilarious names through the years. That's up to you and your family. But we want to blow dry that area with a hair dryer on cool. It turns out one of the big causes of inflammation and irritation is yeast. And so yeast can't live if the area is dry. And we want to keep it as dry as we can, and we want to keep it aired out. And they just love to live in warm and moist environments. So that's why it's such a problem, because it's a warm and moist environment, especially in a little girl that's still in diapers. And so one of the risk factors for a true UTI, especially in a diapered baby, is if they've had recent bouts with diarrhea, because that liquidy stool, especially if in a diaper, can come to the front and then can make that very short trip up the urethra to the bladder and cause trouble. So careful wiping, baking soda baths, blow drying with the hair dryer on cool, staying open to air, always white cotton panties when they do wear panties, but no panties overnight. All these things can just help keep it healthier and happier down there. Also, make sure you don't use anything scented. So, obviously, no scented toilet tissues, colorful toilet tissues, just plain white, unscented is safest down there. Other things that we talk about are after you've done that whole baking soda bath and hair drying on cool, you can put a layer of a diaper cream, even on 4 and 5 and 6-year-old little girls. Desitin works great. It's just zinc oxide and it's a moisture barrier. For the next time they do urinate, then it won't burn as much because it won't touch that sore, irritated skin. But here's what we need to talk about that's also very important. What if it is a true urinary tract infection or UTI? That's important that you do go into the physician. So some clues for a true UTI are very painful urination. A lot of little girls will say they feel like they have glass in their pee-pee as it's coming out. Lower abdominal pain. The bladder's in the very middle at the very bottom. And so if that's where the location of their pain is, that could be one. In severe cases, even both sides, lower back pain over the kidney areas. If the urine has blood in it, we need to check it out. If the urine has a foul smell, especially if all this happens right after they've just had a bout of diarrhea, that would be a bigger red flag as well. Now, if you're ever not sure, call your pediatrician. We're always happy to see you. And what we'll do is on that day of visit, we'll check a quick, what we call dipstick or urinalysis, and that'll tell us, are there clues that there could be a true urinary tract infection like white blood cells, red blood cells, protein, nitrite, stuff like that. So we'll look at a quick little strip test. If it looks positive or concerning for a UTI that day, we'll go ahead and start antibiotics while we await the confirmatory overnight bacterial culture. That's the 100% certain test. And then we even have to send that out for further identification and sensitivities to see which antibiotics would work against that bacteria. Let me also just give you a tip. When you're in the doctor's office to get this specimen, it is super important that you get a good specimen. So we call it a clean catch. That means we want you to wipe carefully front to back, have the child start the urinary stream, and then stick the cup under there to get the specimen. Here's a good tip too. Make sure you write their name on the cup before you try this. It's a lot easier to write it on before than after because it can be a little bit of a messy procedure there. And then we'll have that quick test that same day in the office. So this is a common problem. I hope this has been helpful information, and always call your pediatrician if you have a question of whether or not your daughter could have a true urinary tract infection. Thanks.